And we now talk to House Committee on Health Chairperson Angelina Helen Tan. Good morning, and thank you for taking our call.
Hi, Ria. Good morning. Thank you for the opportunity.
Congresswoman, the Senate held two hearings on this matter last week. What will be the focus of the hearing today at the House of Representatives? What's your objective, and what exactly would you like to find out?
Basically, we want to have an update on the status of the National Vaccination Program roadmap, especially on the supply, allocation, distribution, and the administration. Yes, the Senate conducted two hearings on the national vaccination, but personally, I listened to the hearings, and I'm seeing some inconsistencies in the answers of our guests, especially Secretary Galvez, on the procurement of vaccines. So we wanted to be clarified on those inconsistencies. And also we want to focus more on the safety and efficacy. We've invited our experts, the panel expert, to explain more on so that the viewers and listeners can decide on, or we can help our countrymen to decide on supporting the vaccination program.
Right, Congresswoman, you mentioned the inconsistencies there as far as the procurement of vaccines is concerned. Do you see any other problems with how the government is handling the COVID-19 vaccination program? Are you satisfied with the preparations in procuring these vaccines?
As I mentioned, there are inconsistencies. We want to know how they decided on procuring or negotiating with government or pharmaceutical industry or the maker of the vaccine. Because first and foremost, we wanted the EUA or the Emergency Use Authority first, no, or the review of the clinical data, available clinical data. So because early on, Secretary Galvez has been saying that they've been negotiating with China maker, the Sinovac. But we know that the first to get the EUA is the Pfizer. And according to FDA Director General, next might be is the AstraZeneca. And based on our conversation, he mentioned to me that Sinovac hasn't submitted a complete document to FDA. So we wanted to know from our vaccine czar their parameters or basis on negotiating with government or pharmaceutical industry.
Right, and there are a lot of questions now about the prices and efficacy of some of the vaccines. And during last week's Senate hearings, I think it was Senator Ping Lacson who noted that implementers of the vaccination program, as you said, apparently showed preferences for China's Sinovac, and that, of course, is said to be more expensive compared to other countries' vaccines. So what's your take on that, Congresswoman?
Yes, although they were saying for me, I wanted to at least ask part of the agreement if they can disclose. Of course, part of that agreement will be the cost of the vaccine, which I think should not be or should be disclosed with public. No, hindi naman kailangan isekreto. I think the prices of those vaccines. So it has to be cost effective. Ibig sabihin, if we buy that vaccine, tama ba siya or right for public spending? So we want to finally hear, be specific sana, the answer of our secretary or vaccine czar.
All right, thank you for your time this morning. We really do appreciate it. House Committee on Health Chairperson Angelina Tan.